Yeah, hi. How are you?
Good. How are you?
Not too bad. Thanks for taking the time to chat with me. I really appreciate it.
It's my pleasure. My colleague, Dr. Lampron, will join us shortly.
Fantastic.
My name is Maher Matar. I'm a general surgeon, trauma surgeon, working here at the Civic Campus at the Ottawa Hospital.
I'm a general surgeon with trauma specialties, same way than Dr. Matar. TOH, I'm the trauma medical director. Trauma is divided in penetrating, which include like stabbing, gunshot, and blunt, which is any crash with anything, either jump or crash in car or anything else.
I'm writing about what seems to be an increase of shooting incidents in Ottawa in the past couple of weeks. And I was wondering if the two of you have noticed that or what you are noticing in your practice.
I have checked with our data analyst, and although we also kind of had the feel that it was increasing, but by the number, it's actually about the same. We do have peaks and valley, but so far it's relatively similar to what we had seen in the past.
There may have been a cluster, but as Jacinth says, I think it flattens out when you look over the year or over the month.
Is that a way to describe it? Then there has been a cluster in the past few weeks, perhaps, but overall the statistic remains flat year to year.
Yeah, you can describe it this way. It would really depends what the rest of the year comes. Like we're a little bit on a high trend, but nothing outstanding with other months that we have seen.
Is it general that in the summer there would be an increase, and in the winter there's fewer?
There is an increase in trauma overall. Penetrating do not necessarily follow the season pattern.
When someone is shot but survives or is stabbed, let's say, what kind of after effects can that leave someone with?
It's quite often very serious. Some of them walk away with a kidney missing. Some could be paralyzed. Some are disfigured or are having a brain injury. So it is definitely changing their future. It's not because they're alive that it's all sorted out. Like there's a good amount of work and adaptation even after that they recover from those acute injury.
As Dr. Lampron is saying, there are the physical things that can happen, which are quite serious and debilitating, but there could be also some kind of mental situations that could arrive, like PTSD, that these guys will have a hard time to deal with moving forward.
Do you see gun violence as a public health issue, and do you have any thoughts on that?
Absolutely. Gun violence is a disease, and it should be treated like a disease and approached as a disease with intervention that have been proven to work as public health intervention. It's kind of just recently that this core I've been on, like before it's just, oh, it happens. It does not just happen. This is a disease. It has risk factor. It has like a demographic of it. And we have to find a way to stop that disease. We don't pretend that we know the way. It's extremely complex, and it honestly had probably to be approached by public health agency because it touches on so many things, so many factors, culture. It's not just about the gun. There are many other things involved into that. And probably public health is the best agency to kind of tackle such a wide disease.
If you don't view it as a public health issue, the likelihood of us addressing it is very low. Seatbelts is not a public health, but we know that the intervention of putting in seatbelts in cars has saved millions of lives. And so that's only happened because investment went into it, research went into it. And that's only because it was seen as traffic collisions were seen as a public health issue. And so if we shine the light on gun violence or any violence, at least you'll have the interventions put in, the research put in, as Dr. Lampron says, to identify the things that we can treat to hopefully get over it and kind of get some better control over the situation. I think it's important to realize that, the people that are coming in who are shot or injured due to gun violence or violence are at the end of the day humans. And we realize this, unfortunately, at the end of our situations. For instance, when you've done a resuscitation code, your EMS guys have brought a patient in and they've driven at 100 kilometers per hour, risking their lives and the patient lives, and you're doing your work and the patient passes away. We do our moment of silence to respect the patient in front of us, and then only a day or two later in the news we read about them, you realize it's a 20-year-old or a 21-year-old or a 19-year-old. It does get to you, and so it's unfortunate that these young ages are being involved in these situations, and this is the outcome that's happening. And so to further that discussion on it being a public health situation in the disease, to hopefully be able to find a cure or a solution for it.